Now, to kick it off, how important do you think screening and testing for HIV is in the UK?
Well, thank you, Daisy. And it's always good to start with a question on testing because testing is that critical first step that's a gateway. And it's a gateway because if you test HIV negative, it's an opportunity to talk about how to prevent HIV and other sexually transmitted infections. It's a chance to talk about pre-exposure prophylaxis or PrEP, which is taking HIV medication to dramatically reduce your risk of getting HIV. But of course, if you test HIV positive, it's that chance to get onto treatment, which will ensure one, you can't pass the virus on to your sexual partners, and two, you can live a normal, healthy life knowing that you're taking control by getting that virus undetectable. And I think the key thing to mention is that sexual health is a really important priority for everybody. It's a particular priority for our LGBTQ plus populations because some of them may be at particular risk of sexually transmitted infections, including HIV. And that opportunity to talk, to educate yourself, to educate each other is such an important part of staying healthy in general.
Yeah, you're so right. You mentioned PrEP as being one of the ways in which we can prevent HIV. What other ways can we prevent actually contracting HIV in the first place?
So I think one of the most important things is for people who are living with HIV to be on effective treatment. That undetectable, untransmittable, or U equals U message has really gained traction over recent years. And for the first time in 2023, the World Health Organization also came on board and actually committed to that word zero. And zero is such an empowering concept. It's so important for people who experience stigma, including self-stigma, to know that they are zero risk. So by getting people with HIV undetectable on treatment, that's a really important way of preventing onward transmission. Of course, that requires testing. PrEP, you mentioned, and it's a very, very highly effective method of prevention. But of course, there are other things. We still recommend using condoms. PrEP will only protect you against acquiring HIV. It won't protect you from other infections. Condoms aren't 100% for every infection, but they do dramatically reduce the risk of many, and that includes things like chlamydia and gonorrhea. So regular testing, not just a view of your partners, prompt treatment. If you are diagnosed with an infection, then it's about contacting your partners so that they can get tested and treated if necessary. Condoms, PrEP, and being on antiretroviral therapy if you are living with HIV.